Speaker.
Gentleman from Richmond City, Ms. McClellan.
Thank you, Mr. Speaker. I rise for an introduction and a point of personal privilege.
Gentlewoman may proceed.
Thank you, Mr. Speaker. Joining us in the gallery today, we have Virginia affiliates of the National Urban League representing Northern Virginia, Greater Richmond area, Petersburg, and Hampton. The Virginia Urban League is one of the oldest civil rights organizations, with the Richmond Urban League being established in 1913 as the first affiliate of the National Urban League. The Urban League's mission is to enable African Americans and others to secure economic self-reliance, parity, power, and civil rights through programs, services, research, and advocacy. In 2011 alone, the Virginia Urban League offices have collectively served more than 10,000 Virginia citizens through its employment, housing, health, and education programs. They're here today to discuss certain issues of interest with their members, and I'd ask that you give them a warm welcome.
Gentleman has the floor.
Thank you. Mr. Speaker, I was disappointed this morning when I read your quote in the Richmond Times-Dispatch that you would discourage approval of legislation to create a health benefits exchange. While I was disappointed, I wasn't surprised, because your statement echoes sentiments of Governor McDonnell. However, I find your position and the governor's curious, particularly in light of comments made on Tuesday by the gentleman from Shenandoah that while the governor did not agree with the Federal Affordable Care Act, it was reasonable for him to make budget decisions for the eventuality that it, or portions of it, survived the Supreme Court case. And specifically, those were cuts to Medicaid and health care safety net we've already heard about this week. Isn't it likewise reasonable to look at beginning the process of establishing a health benefits exchange? First, let me be clear on what a health benefits exchange is not. It is not health care reform. It's not even health care insurance reform. In essence, it's a marketplace for individuals and small businesses to purchase health insurance. They offer a variety of certified health plans and provide information and educational services to help individuals and small businesses understand their insurance options. Currently, many individuals and small businesses pay higher insurance rates simply because they lack purchasing power and the ability to pool risk and information. An exchange increases their control and choice by providing information about prices, quality, and physician and hospital networks. Exchanges are intended to keep prices low by increasing competition among private insurance plans through improved comparative shopping and more informed consumers. Many people in both parties thought this concept was a good idea before President Obama was ever elected and Congress began debating the Affordable Care Act. Indeed, Governor McDonnell's candidate for choice for president, Mitt Romney, thought it was such a good idea that on his watch, Massachusetts created the first state health care exchange in 2006. Utah, not exactly known as a bastion of liberalism, passed legislation in 2008 establishing a health care exchange. But unfortunately, our exchange is getting bogged down in politics, the politics of the Affordable Care Act, which does require benefit exchanges in the states. And if the state-run exchange is not on its way to being operational by January of next year, the federal government will set up its own exchange here. Now, in August of 2010, the governor established the Virginia Health Care Reform Initiative Advisory Council to develop recommendations to implement health care reform in Virginia. At that time, the governor said, every Virginian needs access to affordable health care. The challenge is how to provide that access in an economically responsible manner. The recommendations of the council will help create an improved health system that is an economic driver for Virginia while allowing for more effective and efficient delivery of high-quality care at lower costs. Then the VHRI recommended that Virginia create and operate its own exchange to preserve and enhance competition. and suggested that the Governor and the General Assembly create a process to work through the various issues in detail with broad stakeholder input. As a result of that recommendation, last year we passed 95-3 House Bill 2434, which stated our intent that the Commonwealth create and operate its own health benefits exchange to preserve and enhance competition in the health insurance market. We stated 95-3 that the purpose of the exchange would be to facilitate the purchase and sale of qualified health plans in the individual market and to assist qualified small employers in facilitating the enrollment of their employees in qualified health plans offered in the small group market. That bill also required the exchange, 95-3, to meet the federal requirements of the Affordable Care Act, and directed the Secretary of Health and Human Resources to make recommendations this year on how to govern the exchange. And VHRI did that. And yet, when we got their report with their recommendations, the governor sent us a letter, two-thirds of which simply blasted the Affordable Care Act. And he said that we should wait and see what the Supreme Court does before we act. But no one expects the Supreme Court to throw out the entire federal act. And even if they do, I believe all of the bills that have been introduced have a sunset provision to take care of that possibility. Now, no one has argued, or at least no one has argued or taken a position that an exchange is not a good idea. No one wants the federal government to impose its version of an exchange on Virginia. Yet if we don't show enough progress by the January 1st, 2013 deadline, that's exactly what could happen. But regardless of when the deadline is, if we're to have a state exchange, shouldn't we take advantage of the federal funds available to set it up? Shouldn't we take as much time as we can to set the exchange up right, rather than scrambling close to the deadline by which it should be operational, or coming back in a special session at extra taxpayer expense? Shouldn't we start now to provide the insurance industry with the guidance it wants on the rules that will govern plans that they will offer through the exchange, which brings them more business? And shouldn't the legislature, not the administration, make the public policy decisions on where an exchange will be housed and how it will run? Mr. Speaker, there are times when good government takes a back seat to politics. I hope we're not at that point now. I hope that you and the governor will reconsider your position and let us begin the work of establishing a health benefits exchange that will help provide at least 100,000 Virginians new private options for health insurance. Thank you, Mr. Speaker.